Hi, my name's Teresa Youngstrom. I'm the Director of Nursing with Assisting Hands Home Care in the Cincinnati area. A hot topic when we're dealing with elderly individuals is dementia. And sometimes we think dementia in itself is a disease, but truly it's a symptom. It's actually a symptom of 80 to 90 different diagnoses. So what's important to learn about dementia, first of all, is that we can't cure it. And there's no medication that takes it away. So what we have to do is, how do we embrace the symptom of dementia, how it affects our loved one, and how can we equip ourselves with the tools to deal with our family members. I want you to know that initially, if you find that your family member has some forgetfulness, maybe they're confused about a location to meet you, or maybe they're lacking initiative to get up and do something like do the laundry or maybe get a shower, that you need to start investigating, because some dementia can be treated. Maybe it's just a vitamin deficiency or a urinary tract infection. It could be something as simple as that. Maybe it's thyroid. That would be great. But for the most part, dementia can be a 10 to 15 year experience that is chronic, and it's tough, and it changes every day. Some of you I know are in the midst of this and you're struggling. And what I can tell you is, we have to quit trying to put mom in a box and shove her back up to what she used to be. And we need to allow mom to be at this level and love her along here and figure out how to work with her at this level. You're going to need to read some good books. You're going to have to seek some people to get some counsel. But what I want you to know about dementia is, yes, it changes all the time because it's chronic debilitating. But who needs to change is us. We have to change to adapt to our parents' condition of dementia. And as it gets worse and worse, we have to be there and be able to help them at the level they are. We never argue with dementia. They can't process that. It's a brain disease. They have a very short fuse. They'll lose their use of vocabulary, and all of a sudden your sweet mom might spit out some cussing and some words that you've never heard before. That's very normal. But what we need to do is back up. Let's see what we can do to keep mom from getting afraid to the point where she has to go to that fight or flight part of her brain and do some things that she doesn't want to do. A fight with someone with dementia, an argument, is not worth it because it can last several hours. All I can tell you about dementia is that at Assisting Hands, we invest in our caregivers to educate them continuously on dementia so that we can give your loved one the best care that we can. I'm Teresa Youngstrom, Director at Assisting Hands Home.